Hi, my name is Abby Huddleston, and I'm going to be applying for the Missouri Baptist University nursing program. Resilient, advocate, strong, caring, compassionate, kind. All of those words can be used to describe a nurse. I want to be kind and caring and compassionate and an advocate for my patients. And that is what has led me to want to be a nurse. Nursing is more than just administering meds and taking somebody's vitals. Nursing is also loving on the patient when maybe their family isn't there, and loving on the families when they're going through the hardest days of their lives. I want to make sure I am in the correct career path to be a nurse, and I know for a fact that the Lord has called me to be a nurse, to minister to the families and minister to the patients on just how grateful that they should be for life, but also just how during the hardest times, things may not make sense, but they do make sense through the Bible and through what Jesus has in store for us. I am a very kind and compassionate person, at least that's what I would say about myself. Even my coworkers say that I have a big heart and that all I want to do is to take care of patients and make sure that they are happy and, as happy as they can be being in a hospital. I think it's important to remember, though, that as a nurse, and I am currently a tech at Children's, our biggest job and our most important job is advocating for the patient, because sometimes in healthcare settings, those patients don't have somebody to stand up for them and to advocate for what is right and what needs to be done. And I know for a fact that I'm going to be able to do that for my patients. I'm going to be there to love on them and to help them understand things when they don't. But more importantly, I'm going to be there to be an example of Jesus and to tell them that they can turn to me if they need to talk or anything like that. And for them to know that I'm more than just somebody who works in the hospital. I am their nurse, and I care for them, and I genuinely want them to get better. And I think that all of those attributes would make me a great nurse. Additionally, I have a heart for caring for people, and I've always been very maternal. I played with baby dolls for forever, probably longer than I should have, but that has definitely come into play as I work at Children's Hospital. And I just want to love on those babies, and I want to care for them, and I want to love on those kids, and I want them to smile and to laugh, even though that they're experiencing some of the hardest things that they possibly can be experiencing. And I know that that is my heart that Jesus has prepared for me, to be able to help those patients to know that I'm going to be there for them and I'm going to be a great nurse. I chose Missouri Baptist University to pursue my nursing career, mainly because I've heard so many great things about it. I was at Chamberlain School of Nursing prior to starting in the fall of 2020, and Chamberlain School of Nursing was definitely like a factory. They just wanted to turn us out as fast as they can, and that's not a situation that I thrive in. They didn't care about their students in terms of making sure they were okay. They didn't care about us in the sense that we were just a dollar sign to them. And Missouri Baptist, from what I've seen so far, is not like that. Missouri Baptist cares about their students, and that's from what I've been able to tell, even as a student. When I came to meet with an advisor to register for classes, I hadn't even toured the campus. And I went ahead and registered for classes anyways, because I knew exactly that this is where the Lord has led me. I knew that it was time for me to submit my heart to the Lord and to listen to what He is trying to tell me, and I have. And it has been so much of a relief to know that I'm following in the footsteps that the Lord has wanted me to. I am pursuing a career that I'm supposed to be doing, and I'm loving what I'm doing. I'm loving the people that I've met, and I'm loving the teachers and the students, and that they care for me, but also care for my heart and want me to be a better person. As I mentioned, I've heard great things about Missouri Baptist Nursing Program, including from two individuals of my lot family who are currently in the program, though they are graduating this coming May. And it's been so awesome to see them walk through this and just have great, phenomenal things to say about Missouri Baptist Nursing Program, and just how great it is and how great the staff are and the teachers and all of that. And it's just made me realize that that is really where I need to be, in a Jesus-centered school, and that is what Missouri Baptist is all in all. You know, I've been diabetic since I was 3, and so I've been in and out of medical settings for as long as I can remember, and that's also played a big part in me wanting to be a nurse, because I wanted to help those kids. You know, I'm thankful enough to have been diagnosed early, and so I don't know life without it. But there are some kids who don't know what diabetes is, and they're living their life, and they're 13 years old, and all of a sudden they have diabetes and have to change their life. And I want to be there and help those kids and help them through this. Like, I know it's really hard, but here's what's going to happen. But also to help them understand that if you don't take care of yourself now, like, these are the things that can happen later. And I'm a living proof of that. I haven't always taken care of myself, and now my eyesight is not the best because of high blood sugars. I just want to help everybody, and I know I can't help everybody, but being a nurse is the start to helping everybody. I hope you consider me as a candidate for the 2022 cohort.